Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in today. Well, today is a Friday version of the show. It is a get 'em up, out of town version of the show. And in keeping with our pledge, we literally open it up to you. Anything on your mind is okay with me. I've got some weekly roundup issues. I've searched the blogosphere to bring to you that which is the most current medical information, especially with an alternative twist to it that I think you and myself really enjoy hearing about. Also, today at half past the hour, guess who's coming back? Because, folks, it is back. We haven't talked about it in a while, but MCG testing has returned. Now, for those of you out there who have taken me up on that invite in the past, actually received MCG testing, and you're actually waiting to retest, we've had a lull here. We'll talk about that lull and why no longer there is a lull to worry about. The lull is over. MCG is back. We'll give you some information here before the hour is up on what to do, how to do it, to get that next test done. Many of you did qualify to get this test done every 3 months. I mean, 4 times a year. So we started this in February, and first group is up and ready to go. More about that with Jerry Singleton at half past the hour. Now, calendar-wise, here's the way it looks. So on Monday, finally we're going to bring him back. It's been a while. Not that, well, it's just been an oversight on my part. I guess it's the only way to clarify why there's been such delay. I felt at the time, I still feel now, that to find a supplement going out there, now it's pricey. It is something that, however, removes the need to buy all the other components of a well-rounded supplement program. Of course, I'm talking about BAC, B-A-C. That's Bioengineered Algae Concentrate. And Dr. Roland Thomas is going to be our guest on Monday. He brings us the story always of Dr. Michael Kiriak, the Soviet scientist who literally invented, fostered, developed, and continues to maintain the controls on the manufacturing of this daily supplement that still comes from this very day from Siberia. Wow. Anyway, on Monday, Roland Thomas is back with us. On Wednesday, a new guest, Jesse Canone, is here, talking about a 6-step back pain rescue plan. I'll be very interested in asking him some probing questions about that. It is a fond endeavor of mine, chronic pain, so I'll be anxious to hear from him on that. We'll be approaching the end of the month, folks. Come in with your suggestions on shows you may like to re-listen to. I have to take the end of the month to head for a conference, and in that case, I'll be spinning some of the old ones from the past. Not too far in the distant past, can be relatively recent. If you have a favorite that you want to rehear because you missed it or you just thought it was so good that you wanted to listen to it, and you don't have computer access, which would enable you to listen to it any time of the day or night, then give us a call today to tell us what's on your mind. We'll try to schedule one or more of those shows on your behalf. We will, however, be flipping the page soon. We're coming up, not there just quite yet, coming up to the end of the month and be turning the page into the month of July. July is taking shape with respect to the guests. Boom, Dr. Susan Smith-Jones will be with us on the 6th. She wants to talk about natural remedies, a whole host of them, ones that I think she, and we keep hearing about the grandmother, she and her grandmother have fostered over many years, and will bring them to you. I don't think she's ever done that before, too. We talked about so much with this young lady, but never the natural remedies. David Brownstein then comes to us on the 8th talking about Salt, Your Way to Health. The title of one of his books, it gives it away, folks. Salt is very good for you. Of course, that isn't in the form of Morton's, which is pretty much dead salt. You want a live salt. If I can use the term accurately, you need all the nutrients in salt, and salt can provide. And you certainly shouldn't be shirking away because of salt sphere generation that has been developed, I believe, very inappropriately in the vast majority of cases. Anyway, the 8th of July, David Brownstein returns on that subject. On the 11th, Lee Waller is with us, a new guest. I think he's going to present an interesting concept. Many dieters out there, you've heard of Yo-Yo, and I'm not talking about Yo-Yo Ma, a cellist player. I'm talking about Yo-Yo, up and down with the weight. You go on a weight loss binge, and then you go on a weight putting on binge. It's up and down over a long period of time. Anyway, Lee Waller is going to have some tips on sustainable weight loss. I think we'll all be interested in that. Then Alan Ridgway is scheduled to return with us on the 13th. He's been here many times before. He's talked about, well, usually those things will be used by the diabetic. He's sort of the go-to guy when it comes to my diabetic patients. He's the guy that fits the form-fitted shoes and gets all the Lancets and the testing strips and so many other supplies that my diabetic patients need. Many of you out there I know utilize him for those services. Anyway, he's launching a new product here. I've got it in my hands. It's called Simply Freeze. Anyway, I think it's a competitor to something out there in the supplement or pharmaceutical world presently called BioFreeze. For those who have muscular aches and pains, I guess I'll use my office manager Kim as my best testimonial. She's got knee issues, prior surgery of a few months ago. Says this is wonderful stuff when she put it on immediately, and that's one testimonial I take with more than just a grain of salt. So we'll be launching Simply Freeze for a while. I think we're going to be the only venue where you're going to be able to purchase this stuff, so you want to pay attention, especially if you do have arthritic types of muscular aches and pains, joint pains, those kinds of things. Simply Freeze, the product launch will be on the 13th with Alan. That about rounds that out. Yes, oh, by the way, want to mention too, enjoy, did you not? I thought it was a good show we did on Wednesday with Jeff Burke. His 5 nutritional tips to keep your summer vacation from turning into a summer vacation from hell. I thought it turned out to be a great discussion, especially when it came to issues of probiotics, how to select them, how to take them, what not to take them with. I thought that was all valuable information. Enzymes, equally so. These two are thrown out so frequently by those who occupy the host seats of this station. And many times we're dealing with a listening population very well seasoned, certainly understands a lot about them, but I think we went back to the basics. If you need to, dial it up in the archives and get another listen to that show. I think you'll appreciate, especially if you're a newcomer to supplementation and you need to have some basic guidelines to follow when purchasing and taking things like the probiotic line and the enzyme line. Jeff Burke gave you some very good hints and tips on how to pursue just that. Let's do this. We're going to take a short break. When we come back, you can knock on the door if you'd like to, 412-825-6262. I got some weekly roundup issues, things that are happening out there in the medical world I think you'd like to know about. And then don't forget about half past the hour, we'll shift gears a bit and bring Jerry Singleton back. MCG is back. It's now back for good. You'll see what we mean when we return at that half past the hour break. Anyway, be back in a moment. More to come.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Oh, sorry, I've got to go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit. Fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruit with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit is a unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Hey, good morning, everybody. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Friday version of the show. It is a get 'em up, out of town version of the show, and I guess things are going to be heating up, warming up over the weekend. I think when we hit the beginning of next week, we're in a torrid zone by that point. I hope you have a wonderful weekend, and I always like to send you out of here with as much information as we can provide. We open it up to you. We say, hey, if you've got a question or a comment, you can give us a call by dialing us up at 412-825-6262. And when I hear a knock on the door, I'll let you in the store. Guess what? I've heard the knock. Come on in the store. Hello, what's on your mind? Go right ahead.
Yeah, it's Dr. Courtney.
Yes.
Yeah, this is Miss Williams from up in India.
Oh, out there taking those passport photographs up there.
Yeah.
How you doing, sir?
Hey, I got a question on vitamin D.
Go.
My sister had some blood work done here last week, and she got the results back, and they have 2 or 3 different vitamin D levels listed in there. And they have the D2 and the D3.
That's right.
And I didn't realize there was...
So there's 6 of them, actually.
Yeah.
There are 6 vitamin D levels. The other ones, I actually have never found the use for them from a scientific viewpoint. The big one, the one that you need to be paying attention to, is 25-OH-D3. Now, that is not the active form of vitamin D3. The active form is 1,25-dihydroxycholecalciferol.
Yeah.
And that's 125 OH-D3. Yeah. Di-OH-D3. Anyway, I get confused with this myself. Anyway, that one wouldn't be helpful at all to measure. And anyone who asks for that is just pointing out their ignorance of the understanding of vitamin D. The half-life of the active form of the vitamin is so quick that it shouldn't be taken ever as a measurement. But 25-OH-D3 is the measurement that we can have a discussion about and everybody can be on the same page.
Oh, okay.
Do you happen to know what your sister scored in the 25-OH-D3 category?
I'm not sure. I didn't get to see that, the results of that test yet.
Well, unless she's a vitamin D taker, okay, unless she supplements, she's going to be below the normal range of 34 nanograms per milliliter. my running total, and I think all my listeners know about it, you probably heard me say,
Yeah.
all these hundreds of patients I've tested, now the number is 14. I mean, it rises very slowly, but 14 out of all these hundreds have shown me to reveal a normal level of vitamin D3. And by that I mean they're usually just over the line. I've had one or two that were whoppers, but they were taking massive amounts of vitamin D. Every patient who did have a normal level, meaning 34 or higher, was taking a pretty good amount of vitamin D and been doing so for a while. We had to increase their vitamin D to get them to optimal. 34 is not the optimal range. We're always trying to get you to levels of 84, 94, somewhere around 100, and that's the level you want to keep. The benefits to you, health-wise, are far in abundance as compared to those who don't ever achieve those levels.
Oh, okay.
Okay?
So the vitamin D2 level, and you could kind of disregard what that is then.
Yeah, well, because that's unconverted vitamin. You know, it's when the sunlight hits the skin that we get the conversion of the D2 to D3.
Uh-huh.
But we're Pittsburghers, and between September and May, how much skin striking is going on with sun around here?
Yeah.
So no, you got to supplement. You don't have to have a vitamin D2 level at all worthwhile because, well, as a Pittsburgher and northerner, and further north it would get worse. You just can't get enough absorbed vitamin D and then converted vitamin D to get you anywhere near this normal of 34 nanograms per milliliter. So you're going to have to supplement. The nice thing about vitamin D supplementation is it is relatively inexpensive as far as vitamins go. I mean, put the most expensive supplement, which is CoQ10, up against the least expensive supplement, which is vitamin D. Then you begin to see it's really pennies it takes to get that up.
Uh-huh. Okay. All righty. That's all I wanted to touch with you.
Well, hey, look, find out what Sis's level is and then get her on. I will tell you that for a Pittsburgher, and it's true we are in the summertime right now, but if that level is below 34, then 10,000 units, without hesitation, I say 10,000 units a day for around almost a year to be able to get you up to optimal ranges, no matter who the patient has been. That's sort of how it has worked out. But you measure these levels, you don't work in a vacuum, you find out where you start, and you work to an optimum level that you then check, even though I have to admit, I've never heard of toxicities of vitamin D. It just doesn't happen.
Yeah. I think she has been taking 10,000 units of the D3 for a good while now.
Oh, well then I'll be really anxious to hear what her level was, because I'm going to guess that she scored high. How did she know to take that much vitamin D? Did she know that intuitively on her own, or?
She got it from me.
Oh, well, okay. You're spreading the word out there in Indiana, so I expect not only with the minerals, which you've been very helpful to guide people toward the ionic minerals.
Yeah.
You are also helpful in vitamin D supplementation. So keep spreading the word. Keep taking those pictures.
Yep, I'll do that.
All right, sir.
Okay, thanks a lot.
Absolutely.
Bye.
We have a vitamin D report. Yes, 25. OH-D3 is the one you want. 25 OH-D3. And we got another knock on the door. Come on in the store. Hello. Welcome aboard. What's on your mind?
Doctor.
Yes.
Yeah, the other day on Monday, some lady called in about her husband having heart failure and something where the ejection fraction is not any good or something.
Ejection fractions, yes.
And you suggested that she come in. And I have a neighbor who has congestive heart failure, and I was wondering whether if you could just talk a little bit about some of the things you can do at your place for that.
Yeah, I think I said, and I'll now repeat, this congestive heart failure issue is one that unfortunately is just anticipated by the conventional medical doctors to occur as we age. They expect it. As age advances, they expect it to deteriorate slowly, but constantly over time. We say, and not that we say it, we back it up by doing it, that that's ridiculous. That's hogwash, that no one needs, whatever their ejection fraction happens to be, and that's a measure, by the way, of how forceful the ventricles squeeze and how much blood is able to be pumped out of the ventricles at each beat. Now there's a left ventricle, which is pumping out blood to the entire body, and a right ventricle that's pumping it out only to the lungs. And so when you have a left-sided heart failure, where the ejection fraction is diminished in the left ventricle, the symptoms usually are ones of breathing symptoms and shortness of breath and having to stop and rest because you lose your breath. But when the right side of the heart and the right ventricle ejection fraction goes down, that's when you get, as the lady the other day had mentioned, in talking about either her husband or her brother, I forget, that there was a tremendous amount of swelling. And it was appearing in the legs and the hands, especially during standing as opposed to being recumbent. And that's indicative of right-sided failure. Both sides of the heart could be strengthened, and I say there's 4 prongs of attack. I've talked about these 4 prongs of attack for many, many years now. I'll do it quickly again. Here they come. Fix the inflammation in the blood vessels by correcting all of those 9 blood tests that I've given you to order from your doctors. In every single case, those blood tests cause continual inflammation of the lining of the blood vessels, leading to increased amounts of plaque. So that's the first thing that needs to be done in any plan. Number 2, because plaque and the accumulation thereof starves these regions of a blood supply, you must remove plaque, and the only way that I know to do that, and by the way, the conventional medical community doesn't believe you can do that. They feel that that just happens, and the more plaque as time goes on, just expect it. But of course, doing chelation therapy will help reverse that. Then, here's the biggie when it comes to ejection fractions, ECT. You heard me talk about it, sir? Have you heard me mention it before?
Absolutely.
External counterpulsation is a procedure that's done that helps restore vasculature to all areas of the body, in particular the coronary vasculature. And then finally, dealing with the development of clots, which you don't want to allow to form over time. Those 4 prongs of attack. Supplementation-wise, you need 2 ingredients, and that gentleman, or whoever you may be talking about, and that you're calling me about today, you need to bring in the right form of sugars for the heart to get energy to cause a squeezing of the heart to occur, and that is D-ribose. So you can supplement with D-ribose, and then you must compensate for the lack of the spark in a combustion engine, which is each and every mitochondria of each cell, and that is replacing and replenishing CoQ10. And now you have it. That's the way to accomplish a return to normal with respect to ejection fractions. It is possible. It happens all the time around here.
Very good. I'm going to tell it to him, and maybe he can take a visit down there.
Love to see him. Glad you asked the question, and be willing to help anytime.
Appreciate it. Thank you.
Absolutely. Uh-huh.
Bye-bye.
There it is, folks. You downloaded the entire plan. That's it. Here we are sitting on a Friday. It is a get 'em up out of town version of the show. We let you set the agenda if you got a mind to. 412-825-6262 is the number to do that. 412-825-6262. Now, we have a new segment here on Fridays, one I call the Weekly Roundup. I do search the blogosphere often, and I come up with articles that literally can come from anywhere in this entire world. This one caught my eye today, and it has to do with autism screening. We have had many a show over the years with respect to the rise in autism, what we feel probably has led to that rise, and what to do about the autistic population in terms of actually getting benefit. I think the people who are the saddest players in the whole autistic spectrum disorder milieu, I think the saddest component, and it's embarrassing to say, is the pediatricians themselves. There is a fight that has gone on and continues to rage about this disease called autism and what to do about it. That fight is represented quite clearly in an article that I picked up this morning talking about autism screening called into question. That's the byline. And this is an article I got out of the Huffington Post, and I'm looking for an author, and I actually can't find one, but I think by passing on to you this information, it will really show the dilemma as well as the conundrum and verify that there's not going to be much progress in this, unfortunately. Here's what I mean. Starts out by talking about a Dr. Monica Sims, who in her office, as a routine 18-month visit for all kiddies that she sees as a pediatrician, she gives the parents a survey screening for their child's autism spectrum disorder. Now, this is something that has been encouraged by the Academy, the American Academy of Pediatrics. This survey is in accordance with the guidelines set from the Centers for Disease Control and the AAP. It includes 23 questions. And I'm not going to go through all 23 questions because, quite frankly, I don't even know the 23 questions. But the point made here is that there are 4 questions that Dr. Sims, who appears to want to really be doing a good job trying to detect if any presence of autism, is at least screening her kitties for, and her kiddies. And the 4 key questions, and I think this is what I'd like to pass on to you, are these. Is the child bringing you objects? Pretty easy to determine, and it's important to find out if that is happening in your child or not. Is the child making good eye contact? That's question number 2. Question number 3. Is the child pointing at things? And number 4, is the child responding to his or her name? These are selected by Dr. Sims as the 4 most important questions that are to be asked and should be asked and can easily be asked of parents with respect to their kids. And she does it at their routine 18-month visit. Now, I see a problem in that. Do you see the problem that I see in this? Not that she's asking the questions, but that she's asking it at the 18-month visit. I'm telling you, it's the wrong visit to ask the question. And the reason why I'm saying that is that the vaccine schedule, as I know it, requires that the MMR be given at the 18-month visit. And so if on the way in the door, the child sits there having not received their MMR vaccine yet, I mean, the parents have arrived, the child's arrived, and you get into a discussion as to whether or not these 4 main questions can be answered honestly to detect the presence of autism, I'm going to tell you this, that you're going to detect very little opportunity to find autism in the 18-month visit, because it's, in my experience, after the 18-month visit that all of the cases of autism, and I don't want to use the word all, it sounds like 100%. I'll just say the vast majority, well beyond 50 and 60% of the patients that I discuss autism with the parents of those patients, things are going well up to the 18-month visit. It was after the visit and after the MMR vaccine was given that crazy thing, sometimes happening on the very day and the very moment that the vaccine is administered, other times just it was the point that everything changed. So I see 2 holes here. One, that this routine visit at 18 months is where the American Academy of Pediatrics says you should place the questionnaire I say wrong place if you're going to want to detect this. And I do agree that the 4 questions are good ones, and unfortunately, I'm not so sure that all these questions are being asked by all pediatricians. Now, that's the one camp. That's the vigilant camp. I find holes in this vigilant camp because of the timing of when these questions are being asked. However, there's another camp. And a new study released Monday suggests otherwise, meaning is routine autism screening absolutely important? And the Dr. Sims had said there is so much misinformation and fear out there. It's a great tool, meaning those that 23 question questionnaire and the 4 questions that I brought to you. However, as of Monday, another article hits the same publication, the Pediatrics Journal, for the American Academy of Pediatrics. In this case, researchers question if routine autism screening is actually an effective public health tool. And they determined that there's not enough evidence to support the implementation of routine screening. So, as you can see, the other camp is alive and well. To arrive at this other camp at their conclusion, the researchers asked 7 different questions about the efficacy of the screening. Of those, co-authored Dr. Jan Willem Gorder of McMaster University in Canada singled out 3 as the most important questions. Question number 1 is autism a disorder that has significant impact on the lives of people? That's question number 1. Number 2, are the tests effective for autism? And number 3, are there sufficient tools to help patients after a diagnosis has been made? Now, when you ask those questions, you'll find out that question number 1, absolutely, according to Dr. Gorder, that autism is a disorder that has significant impact on the lives of people. That one's for sure. But when you get to questions 2 and 3, 2 being, are there tests to effectively test for this disorder? The answer is absolutely not. And when you get to question number 3, are there sufficient tools to help patients after a diagnosis has been made? You then wind up with the real conundrum for the pediatric community in that they actually have no treatment at all. They have training, they have behavioral training in which they attempt to maximize how well this individual child can perform with the limitation that they have. But no therapies that I see come out of the pediatric community to correct autism, which absolutely has a correctable component that all children should be allowed to pursue, but is never ever reported by the pediatrician themselves. So the dilemma is, got a great questionnaire. It could really point out that there's autism present. It's being asked at the wrong visit, in my opinion. And then the bigger faction, the larger faction, I believe the one that really permeates the pediatric community is, hey, why are we doing this anyway? Even if we find it, we're not going to be able to do anything about it because we have no treatments for these kids. There's the dilemma, and there's the way that the problem will continue from this day forward for quite some time, unless something comes in to change that equation. I now jump down off of the hobby horse and say to you, hope you are interested in that little discussion. All right, let's take a break. Gonna go find Jerry. You all know Jerry. MCG is back, and if you were involved in it before, you're going to want to be involved in it again. Many of you are waiting for test number 2. We'll be talking about that in a moment with Jerry Singleton. Be right back here with him.
Have you been to the doctor
lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit the Spirit. The blessings of Fruit the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit the Spirit, a blessing for your good health. Fruit the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, everybody. Welcome back once again to AM Impact on Your Health. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on this Friday version of the show. It is a get 'em up, out-of-town version of this show, which we always like to bring you on Friday, allowing you to dial us up and getting off your chest. Anything on your mind is okay with me. As you can see, even the blogosphere brings things that get my blood boiling. I got it off my chest. I'm feeling pretty good about it now. You may have an issue to want to raise that I haven't mentioned before. You may want to comment on the autism issue itself. Certainly hasn't changed much over many, many years. Anyway, 412-825-6262 is the number to do just that. Now, we're not looking for Jerry. Can't find him. Yet I still want to talk to you about the MCG testing, which, as you should well know by now, is something we have prided ourselves here at the office since February. February we launched this unique device. MCG stands for multifunctional cardiograms. And I told you I never really liked the term, but that's the moniker that's been laid on this device. It is a electronic wizard device from space age technology that allows for the ability in a 6-minute test where there's no invasiveness. You lie on a bed. You have clips around each of the wrists, each of the ankles, and one lead off the left side of the chest, and literally are scanned like a EKG machine for 82-second tests. There in 6 minutes there will be 5 tests run, and that data will be able to ascertain information from 166 different data points. I know it sounds confusing, but here's the vernacular to it, and I'm going to get to this call, and that is this: that with this assessment, you should be able, and you are able, to determine the status of the coronary arteries so succinctly, so well defined, as if you had had a cardiac catheterization, but without ever having a cardiac cath. This has been a strong tool that we've used here in the office. It's been not mentioned here by me for a while. I'll tell you that why in a moment. Nonetheless, it is now back, and we'll talk to you about how you get at it in just a moment. But we do have a knock on the door. Come on, the store. Hello, and welcome aboard. Hello?
Good morning, Dr. Courtney.
Yes.
Hi. I wanted to know, and you may have discussed this recently with a question, but do you still sell the L-carnosine drops for the eyes?
Oh, yeah. Yeah, absolutely. Uh-huh.
Okay.
L-carnosine. We have to get it from England, as we normally did, but yes, it's still purchasable, and we do carry it.
Okay. Because I guess Vitamin Research stopped a few years ago.
I didn't. Oh, by the way, that's when we had to go to Britain to get it. We used to get it from Vitamin Research, and it is true.
Why did they?
They couldn't get L-carnosine anywhere, the crude L-carnosine anywhere in the entire United States. And I don't think I have an answer for you on why the source dried up, but I got a feeling the FDA had something to do with it. Yet they couldn't prevent European countries from getting it, and that's why we had to get our source from Great Britain. It was legally obtained and legally sold. It's just it wasn't manufactured anymore here, and Vitamin Research was where we initially did get the product. Yeah.
Okay, and what does it help? The cataracts, glaucoma, or both?
It is most designed to help cataract formation or the reversal of cataracts that have already formed.
Okay, what about macular?
It does not have any effect, in my opinion, on macular degeneration at all. That's an entirely different organism, or entirely different bug in terms of the retina.
Someone had said that they can make it, like if you go to compounding pharmacists, if they have the ingredients, they can make it, but only in a sanitary environment. Like, I guess it has to be,
well,
tested every so
if they can make it, they have to have the raw material. In other words, they can't. What I see as being maybe incorrect about what you just said is, if it could have been compounded, we would have gotten it in a compounded form when Vitamin Research was unable to make it. So I'm not so sure that's actually the case, because the sources dried up. It's not like the company just decided not to make it on their own. They could no longer get the L-carnosine. Now, I don't know how you compound something that is unobtainable. So I think that may be an error.
I think it was, like you said, it was helping too many people, and the FDA wanted to stop it.
Yeah, well, I didn't say that, but I think you grabbed my inflection. Yeah, that's read between the lines.
Okay.
Unfortunately, it may have been helping. There's all sorts of research from the Russians on how well the stuff works. So, and I will tell you that when I discussed this with Dr. Kondrat, he does approve of L-carnosine. He thinks it's a wonderful way to help work with cataract patients. He actually has a couple offshoots of it that have some additional ingredients, but the basic L-carnosine itself is one that he would recommend.
Yeah, I think that's when he discussed it on your show.
Yeah.
Okay.
Uh-huh.
So I do take it in pill form. It comes in a capsule, but I think the best route would be right in the eye.
Right in the eye, yeah.
Okay.
I've never dispensed it in the pill form.
Yeah.
I've only ever had it in the drops. So, let's instill it in the eye, where there's some way to get this directly to the lens itself and help to get rid of calcium deposits. That's, of course, what's occurring in cataract formation. Calcium is depositing on the lens, and this literally is able to help dissolve that calcium.
Okay. And what is the manufacturer of yours?
I can't offhand tell you. It comes from Great Britain, and I'm sure we would have the name of the supplier, and the name of the manufacturer would be right on the bottle.
Okay. Thanks, Doctor.
Absolutely. Good question. It's acetyl L-carnosine. That's the name of the substance that's helped a lot of folks with respect to cataract formation. I think it's pretty safe to say it stops most cataract formations in their tracks and doesn't allow it to progress any further. And then 80% of patients able to back up their cataract deposition, calcium deposition status to an improved form. 80%, that's a pretty high number. And so I would recommend it especially overdoing the surgery just willy-nilly right off the bat. Be a good first step to take. We have another knock on the door. Come on, the store. Hello and welcome aboard. What's on your mind?
Hey, Dr. Courtney, it's Terry. I was calling regarding the eye drops. We actually purchased those online from the company, the Russian researcher who did the initial research on this.
Oh my goodness! Treatment,
yeah, it's out there. If you type in, L-carnosine eye drops in a Google browser, I think it comes up as trying to remember now, CON-C, maybe CON-C or something like that. But we were able to. It's very easy to find with a Google search, and we ordered it online. My father-in-law is in his mid-70s, and the eye doctor was talking to him about having cataract surgery. And, one of the things that tells you in that research is that you cannot get sufficient L-carnosine concentration in the eye by taking it orally. You have to use the eye drop.
I would have figured. Yeah, I would have figured that.
Yeah. And so I wanted to mention that in response to the caller.
Great point to make.
My father-in-law, his experience, it tells you in the literature that the first 3 to 6 months you probably won't notice any effect. And the story with my father-in-law is that he, after he's taken the eye drops about 3 or 4 months, I said, well, how are you doing? How is it going? Do you notice anything? And he said, no, not really. And he said, I don't think they're doing anything. But a little later in conversation, a separate conversation, he happened to mention to one of the other family members that lately he can't wear his eyeglasses when he's driving because he doesn't need them anymore. And
you didn't pick up on that, huh?
I picked up on this, and I said, did you just tell me that the eyeglasses that you always wore for nearsighted guys that have eyeglasses see too far away, you don't wear them anymore because you see better without them than you do with the eyeglasses? And he said, yeah. And I said, well, what do you suppose is the attribute that to? And he said, I don't know. I can't explain it. And I said, did you ever think it might be the eye drops that you're using?
That's funny.
He had not made that connection, which really amazed me. But so then we bought a 6-month supply. And I really didn't think that he was going to order the new supply. And when he ran out, he called me and said, I want those drops. And he had gone to his eye doctor, and he said his cataract had actually improved a little bit. They had not progressed. And they had told him previously that by the end of the year, he would have to have surgery. And, it was gone away, but they haven't. They have improved slightly, and also he doesn't wear his eyeglasses any longer to drive.
Exactly right, and then for the ophthalmologist not to comment, because I'm telling you, that ophthalmologist doesn't see such reversals. It doesn't happen. And for him to just, in a cavalier way, say, oh, by the way, yeah, this thing has improved somewhat, and not be, see, to me, if I was examining a patient and I knew I was seeing something that just doesn't happen, I wouldn't let that guy get out the door without telling, what are you doing? What is it you're taking? Where are you getting that stuff? And why isn't it that they didn't make a big fuss? Well, maybe we're answering our own question here. But be that as it may, I'm happy for your father-in-law. Thanks for mentioning a few things. I didn't realize that it was available online in a form that comes from the original investigators. That's neat. Nonetheless, as long as we're getting the same concentration of the same material, it doesn't have to come from that source to be okay. I think that'd be safe to say. I think the thing about instilling it in the eye is very good advice, and I can understand why the literature would say to try to get that to any level and concentration in the eye from an oral source. Pretty tough to do.
Right.
Pretty tough. Thank you for your input. Always love it. Yep. Very good. There you go, folks. You see, L-carnosine is ranked pretty high out there, and I think about 3 to 6 months is probably a good guide to take. And if you suddenly don't need your glasses for driving, maybe the stuff is worth it. Just maybe. Okay. We open it up to you again, folks. 412-825-6262. Anything on your mind is okay with me. Question or comment? More on the MCG issue. MCG testing, we had 4 different testing days between February and May. They were well attended by you. We opened it up to you, and you did take me up on my offer. We had an opportunity to meet a lot of new folks that we had not met before. It was really neat to meet them because most of them heard of this because they listened to the show. And they just were out there and listening and enjoying the show, and finally we got a chance to meet by virtue of the MCG test. What you should know is that, and those of you who were tested already do know, based on the kind of scores that you turned in, some score between 0 and 20, based on the score, you're enabled to, and your insurer will enable you to be retested as frequently as once every 3 months, 4 times a year, to check the progress of your disease. And because we try to put into play a plan to reverse that disease, it's now time for that first round of people to call me up and sign up because MCG testing is back. Now, the reason why there was a lull, folks, is that we were working out an arrangement with the company where the company came in and actually did the testing for us. They did that 4 times, and finally they said, look, we like you people, we like doing these tests, but you have to negotiate a purchase of this machine. And this is what we've been doing over the last few weeks. We finally negotiated that purchase. The machine is on its way. It will be arriving here, and we, at that point, would mean then that we'll have the device in the office at all times. So, yes, we might do it 1 or 2 days a month, but the machine will be here forever because we will have purchased it, and the issue of MCG testing will be frequently mentioned on the airways each and every time a new testing date comes up. So if you have scored, I'm going to say in a level 5 or 6 or higher, I had told you that you should be tested every 3 months. You need to call to schedule. I don't have the date. It's going to be sometime in July. Pay attention. Listen to the shows, and I'll give you that date the moment that I have inked it with Jerry, and once we have inked it, you can call in and schedule. But we're now ready to do the second test and the first test for those of you who have never been tested at all. MCG, multifunctional cardiogram water device. All right, we do have a knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind?
Hey, Dr. Courtney, it's Jerry from Prologue.
Oh, Jerry, we couldn't find you, Jerry.
No, I missed your call, and then I tried to call back into the show. I do apologize.
Well, Jerry, I had to sort of pick up, and I think I gave our listeners information about MCG. I know a little bit about it because
I was listening. Yeah, it sounded like you covered most of the bases there.
Yeah, and so what I wanted to do is be able to tell these folks that, look, we're coming back because we now have a device. You've been so nice coming to our office and the offices of other doctors to do this testing, to really show us what a tool this is. And now we've taken the steps to purchase that device. And so you're allowed to return, Jerry. You're allowed to come back. Did you come up with a date in July that you can do this? Usually Thursday was a good day for us. Do you have a date?
Sure. I was thinking probably either, and double check on your end, Dr. Courtney, but I was thinking maybe either July 20, somewhere around July 21st I thought would be a good time frame. But you take a look on your end and tell me if that doesn't sound okay.
All right.
So between the 14th and the 21st is what I had in mind.
All right. I'm going to take a look at both of those dates. So, folks, don't just call up just yet, but we're going to, by the time Monday rolls around, Jerry, I could take any one of those 2 dates. Is that okay with you?
That's correct. Yes,
okay, so it's either...
The 21st. We got a couple weeks away for your listeners.
Yeah, so between the 14th and the 21st. So out there, folks, if you've tested before and you had a score of, is it 5 or higher, Jerry? Is that what it is?
It's really 4.
higher. And the reason for that, Dr. Courtney, is because I a lot of times explain this to patients in a similar way to how we would follow, blood work on a cholesterol level or blood pressure, on a blood pressure level. This is the sort of testing that really offers us a lot of movement as far as tracking a patient over time. And so it's really important not to just be tested once, but to see where we're headed. If the patient's making good decisions, we should see a slight, decline in their score, which is what we want. That's phenomenal. And if we're kind of moving in the wrong direction, we need to have that information as well. So it's real important to be tested multiple times a year to follow the patient. So absolutely, I would say 4 and above, Dr. Courtney.
4 and above are allowed to be tested once every 3 months. Is that right?
Once every 3 months, right? That's the way that Medicare has suggested it in their local coverage decision. LCD is how we refer to it in the healthcare community. So, and they do that. They're not doing that for to just give away services. They're doing that because they really believe that from a preventative medicine standpoint, that's really the time schedule for these patients. So I'd say probably every 3 months for any patient of 4 and above, I get called in, and Dr. Courtney, you can obviously make the final determination on that, but that's a good guideline, sure.
Wow, that's great. I actually didn't think it had dipped that low. That's a wonderful way to keep track, and of course, you and I know, but we have a little thing going on between you and me about how to keep changing these scores and improving them. Of course, I've told you from day one, Jerry, what can be done and should be done is not getting done out there in the conventional community. You're the guy that hops around so much and gets a very good look at other offices and how they're using this test. Jerry, I don't want you to say a word, Jerry, but I know that it's just not happening out there in the conventional community, and you can remain silent, Jerry, but I cannot. Okay, and I've got to let our listeners know.
Courtney, and I really think that as long as the patients actively take a participation in this, because this is real important stuff. They say 1 in 3 Americans have some level of coronary buildup. So it's really, really important. It's the #1 cause of death in the United States. If there's patients out there haven't been screened for it yet, they should really call into the office, go and see if they're a fit for it. Get scheduled. It's like you said, it's a 5-minute test, 6-minute test. It's very quick. It's very, very accurate. More journals are coming out every couple of months, and we're finding it enormously repeatable. So yeah, let's get patients in.
We're going to be bringing you back, Jerry. Thanks for the call. It was really nice touch. As we now hit the bongo moment, Jerry, signaling our time out of here, folks. Hope you've enjoyed our show today. If you have the MCG testing in your past, 4 or higher in your score, give us a call. I'll know by Monday what date, 14 or 21. By the way, Monday, Roland Thomas is here talking about bioengineered algae concentrates. Until then, this is Dr. Dennis Courtney with Mr. Jerry Singleton saying so long for AIM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724